Good evening, class. Welcome to this particular unit, that is primary healthcare. I'll be taking you through from where you left previously, that is in the physical class. Now, I want to introduce primary healthcare and the component, what we call the community-based healthcare. Now, in the previous class discussions, we had discussed on issues of primary healthcare, the principles, the elements, and so on. Now, today I want to introduce another concept of primary healthcare, what we refer to as the community-based healthcare. Now, healthcare services are very important to any community because it promotes the health well-being of the members of the community. And therefore, it's normally very important for the community members to participate in this particular program. Now, I have outlined various activities in which the community members can be able to participate to promote the health within the community setup. Now, one of the important aspects or one of the important activities I'm going to mention here is awareness creation. Now, community members have the responsibility to create awareness among the members of the community concerning any health issue, and also how the government can come in and help them. So, when we talk about community awareness, we are involving the members of the community to ensure that they are well informed of any health activity which either planned by NGO or by government or private sector to promote the well-being of the community members. So they themselves, they can create the awareness. Now we also have number 2, what we call community self-selection. Now the community members can select from amongst themselves those that can be able to help in running the programs which are going to promote health. So the process, what we call the self-selection. So they select members whom of course are going to undergo training so as to help in delivering the health services to their community members. Now, number 3, we have training and supervision. Now, of course, after the members have selected among themselves, because not everyone can be trained because of the inability of the resources to enable proper training. So those members who are selected can now be trained and supervised on carrying out the normal health activities which are going to help the members. For example, they can be trained as community health workers to help in delivering services through the health center, dispensaries, or they can also be trained as traditional birth attendant, what we call the TBA. Now, also another activity in which the members of the community can participate to ensure promotion of health among themselves is what is called follow-up programs. Now, we are aware that in the community setup, we have those members who are disabled, especially the children. So they can follow up those who are disabled and having health issues, like the children, so that they can be able to reach them and assist them accordingly, of course, through the guidance of the Ministry of the Health in the counties. We also have follow-up on patients who have chronic health infections like the HIV, cancer, and diabetes. Now, the members who are trained can follow up on how to reach out to the particular members so that, for example, they are able to adhere to the particular animal drug that they're being prescribed. Okay? For the case of the cancer and diabetes, even HIV, normally some people who are sick, the patients, they may forget to take the drugs or to follow a particular time frame for the drug. So it is important for those who are trained as community health workers to do a follow-up, or even social workers to do a follow-up to ensure that their members actually are adhering to the prescription as given, and also following up on various forms of nutrition to promote and also to promote quicker or faster healing of the infections. We also have activity like the water project. So the members of the community, of course, by the help of the government and also the private sector, they can organize water project. We are aware that in many parts of our country, in Kenya, for example, within the counties, there are some regions which are not able to access water, the clean water. So through the government and also the county government and the local authority, they can be able to come up with a project, okay, how to drill in boreholes so that the members can go to access water for their daily needs. Also, we have schools. Now, we are aware that schools are very important part of the society, because from there is where we train our children what they become in the future. And also, it is very important that within the school setup, the members of the community, especially the children, when they attend the schools, they can be taught health issues, health programs. For example, how to carry out sanitation and hygiene, how to manage some of the common problems, that in terms of what we can call the interruptions of learning. For example, we have issues to do with teenage pregnancies, issues to do with drugs and so on. So they can be taught on how to avoid such kind of activities. So through the schooling, the children can be taught on how to become better members of society. We can come up with programs to help ensure that the children are well informed on how they can help themselves to avoid such kind of evils within the society. We also have community mobilization. As we have said already, the members of the community are able to mobilize themselves because they have the power to do so. And then through that, they are able to ensure that every member of the community is adhering to the regulations and the rules which they are programmed to help, for example, prevent infection or even to promote good health, good nutrition, and also other aspects that we can help them earn income. You also mentioned good nutrition. Nutrition is a very good component of health. Without food, that we cannot talk about a healthy society. So it is very important to promote nutrition among the members of the communities. Although we are aware of different climatic conditions which may favor agriculture or farming, we can come up with other programs which can be able to help the community members to be food secure. For example, they can do what we normally call the kitchen gardening to help them actually to make them food secure. We have also mentioned immunization. This is a very good program done through the KP, Ministry of Health. So this program cannot be effective enough to the members unless they themselves become part of it. We are aware about the various immunization programs run by the government, like the one for polio, the one for rubella, and so on. Now, without informing the members of society, they can't be able to be informed on how to access these services for immunization or vaccination. So, through this program, they can be alerted on how to be able to access these programs, the members of the community, and how to prevent such infections which are associated with lack of immunization. Now we have health clinics. Already we have mentioned and talked about the community of the workers, the TBS, and so on. Now these members of society are very important in ensuring that the members of the community are able to access health care services. Okay? So they are set within the clinics or dispensaries or even the community health centers to help them able to reach their members. So through the Ministry of Health, they can be able to reach members and help the government to realize healthy nation. And lastly, we have outreach services. Outreach services, these are services that the members can be able to program themselves, especially those already trained. They can give out back to the society by training other members of the society so that they themselves also be able to meet and achieve the objective of the primary health care. Otherwise, in our next class discussion, we shall be able to look at other aspects of the community-based health care and how the community can be able to achieve a healthy lifestyle. Otherwise, thank you.